Hey guys, welcome to my first video blog post for Fitness with Philip Bondi. I want to welcome you to either my YouTube channel or my blog or my website, which is where you're viewing this video. And today we're going to keep it real simple. We're going to talk about a subject that I find a lot of people have either had experience with, or they've experienced it at some point in their life, or they know somebody who has these issues. So hopefully you can learn something new today, or hopefully you can at least apply something I've said today in your personal life or in someone else's life. So that is back injuries and how to exercise in a way that strengthens your back, keeps it from getting injured in the future. But if you already have an existing injury, how do we exercise in a way that will keep your back safe? And this is on my mind because I actually just hurt my back doing a deadlift that was extremely heavy. And when things tend to be very heavy, sometimes our form tends to slip, and therefore injuries happen. So in all things, I'm going to preface it by saying anytime you do any sort of workout, you have to make sure that your form is impeccable, especially for your spinal health. There's a lot of things that your spine does, and there's a lot of nerves and muscles that run through your spine and attach into your spine, a lot of soft tissue issues. Even your vertebrae themselves can be easily damaged. They can withstand a lot. They are very strong, but we do have to be very careful. So one of the main injuries that happens with the spine is slipping a disc or damaging your intervertebral discs that cushion your vertebra. And these discs tend to be very strong. So when you've injured one, it's generally an overuse injury. It's not something that you just did accidentally. Well, you probably did it accidentally, but it's not something that just happens lightly. You've actually done very serious damage. This can happen from lifting a load that is too heavy. So like my deadlift experience, I was putting my discs at risk of slipping because the load was too heavy. It can come from an outside force, so a very strong force that it hits the spine can cause a disc slipping, and also just age and mistreatment of the spine when someone is younger and then they get older and there's disc slips. Sometimes just age or genetics or overuse. So a number of things can cause the disc to slip. And once it does slip, it doesn't heal easily. It's not a highly vascular area, and it oftentimes comes with a lot of pain, and therefore people tend to stay away from exercising when they're in pain. The problem with that is that the disc itself gets a lot of its nutrients from exercise. It takes in a lot of water, it swells up, it excretes the water, and that's its main source of nutrients. So we really do want to exercise our spine and exercise our body to keep our spine healthy. So I don't want to scare you away from exercise. Exercise is good for the spine. We just have to be very careful in the way in which we exercise. So another injury people can have, they can strain their soft tissue. So we're talking tendons, ligaments, and muscles. Probably the most common thing that people have is that they just strain their muscle by doing too much or using poor form. I know in my line of work I see a lot of people who really have trouble keeping their lumbar back and lumbar spine in a good healthy position that's not going to put it at risk of damage. They tend to do a lot of lumbar flexion, especially in deadlifts. I'm constantly telling my clients, preserve lumbar curvature. Same thing with squats. Sorry, not the spine. Same thing with squats. It's very important to keep that lumbar spine preserved and in the natural shape that it takes in nature. By flexing it, you are now putting a stress unnecessarily on that lumbar spine, and it's not going to be as strong, and it's going to put it at risk of damage. Okay, so that's very important. Tendons and ligaments and muscles tend to be more vascular than the discs, so they will heal faster. However, tendons and ligaments sometimes can be tricky to heal. I know with people who aren't active, sometimes those tendons and ligaments actually they kind of adhere to each other, and that can cause some flexibility issues and some pain. So if you're coming into an exercise program and you haven't been exercising, that's something you want to be mindful of, is back pain and how flexible your spine is. If you're stiff, you really want to make sure you're getting a good warm-up in, and after your warm-up, you want to do some stretches before you start lifting anything, okay? Very important. Another thing that can be injured is the nerves in your spine. This can oftentimes be because of tight muscles that are now compressing or pulling on the nerves. This could be because someone has a pre-existing condition, like I've got scoliosis. So in my lumbar spine, there's about like a 20 to 30 degree curve, not real extreme. But even that, if I let it go and I don't get to my adjustment on time, I can feel the nerves are being pulled because the vertebrae are going to be out of place. Things like that can cause a lot of nerve pain. Along with pain, nerves also can have tingling or burning sensations. If you feel a tingling down your leg or in your lower back, that is definitely a nerve. That is not a muscle. That is not a tendon, not a bone. That is a nerve that is firing. Okay. So when we're talking about keeping the spine healthy and we're talking about strengthening the spine and exercising the spine, stretching is a very important part of that. So it's important to make sure you're doing a regular stretch routine that includes spinal stretching. I'm going to post something on my website about stretching. If not, I'll post it to my YouTube channel. I'll find a YouTube video that I can show you that has some good spinal stretches, and I'll just embed it into my website rather than show you now. But a few things that are really important is to lie on your back and just wrap your hands under your knees and pull your knees into your chest. That's really great for lower back pain because lower back pain is often stress on the lumbar spine, and by flexing it, you can oftentimes increase some fluid motion and also increase the stress and the limberness of the soft tissue and the hard tissue in your lumbar spine. So that's very important. Sometimes with lower back pain, hamstring stretching is very important. I cannot tell you how many of my clients have tight hamstrings, and it can lead to a lower back issue because there's a kinetic chain from the top of your head down to your foot. It's all connected in some way, shape, or form. So tight hamstrings, that tightness is going to pull on the nerves, therefore can pull on the vertebra, can pull on other soft tissue, and cause a lot of pain. So good hamstring stretches would be to sit on the floor and reach for your toes. That's going to get your lower back and your hamstrings. Make sure to keep your legs straight. Okay, the minute your knee starts to bend, you are not getting as effective of a hamstring stretch. Okay, and also too, laying on your back and wrapping a towel around your foot and pulling your leg up into the air while it's straight is another very effective and very minimally invasive hamstring stretch that's also going to improve your spinal stretch. If you're having some sciatic nerve issues, you want to do the twist stretch. So you're going to lay on your back and you're going to take one knee and cross it over and kind of create a twisting motion in your lower back. That's going to relieve a lot of your sciatic nerve issues. It's going to strengthen a lot of those muscles that are tight. Also to proper gluteal stretching. So crossing one leg, laying on your back and crossing one leg over the other, and then pulling on the other leg into your chest is going to really stretch out that piriformis muscle and other gluteal muscles that are going to be tight. And when those are tight, you're going to have lower back pain. And last but not least, we're going to talk about some exercises you can do to strengthen the spine, especially if you already have an injury. And these I'm not actually going to really go and explain in too much detail, but what I'm going to do is I'm going to talk to you about them a little bit, and then I'm going to post a video to my website, and it's going to have a demonstration of these two types of exercises. And so you'll have an idea of if you're looking to do this at home, or if you work with a trainer, or if you're going to come work with me in the future, things that we can do to keep your spine in good shape. And those are McKenzie exercises and dynamic lumbar stabilization. These are the two most commonly used exercises for lower back when it comes to what a physical therapist is going to use. Even chiropractors can recommend these, but they're very popular with physical therapists. And even personal trainers, if they know how to do the technique properly, they're extremely effective. And the videos that I'm going to post on my website will have all of the directions on how to do those. I'll have different examples, and it'll be very, very clear. So that completes the first blog post that I'm making. It's a video blog, I should say. I thank you all for listening. I'm going to do a quick product shout out right now. It's a product that I use post-workout, and that is Cellucor whey protein. Okay, we're looking at, it's got about 25 to 26 grams of protein per serving. I do about 1 to 2 servings, and I do it only after I'm done working out, post-workout, because got about 30 minutes to get a good source of protein in before your body's going to start searching for other sources to get the protein. It tastes great. There's no added sugar. There's a number of different flavors. I would recommend the peanut butter marshmallow, which is what I have here, or you can do the cake batter. It's really good. If you're going to put your protein powder in oatmeal, I would recommend doing the cake batter and not the peanut butter marshmallow. But if you're going to do it just straight with water like I do it, then I would say definitely go with the peanut butter marshmallow. It tastes great. If you live in the Fresno Clovis area, you're going to want to get this at my friend's store. It's Core Sports Nutrition. Very knowledgeable. A lot of good products. Great price. You're going to pay the same as what you'd pay online, minus the shipping. So it's definitely cheaper to get it from the store. And also, they can help you with your goals. I know my friend Greg works there. He does a lot of dietary nutrition diets for people, helps them with their nutrition, especially when you're talking about bodybuilding and comp diets. He does a great job with that. So if you're in the Fresno Clovis area, stop by, check them out. If you're somewhere else in the world viewing my blog, you can get them online, or most supplement stores will have Cellucor whey protein. All right, you guys, I'm going to talk to you soon, and have a great night. Thank you.